It's really a sad one. Yes, it's a sad one because I just gave birth. My breast milk supply is low, but I really do want to breastfeed my child. The question is, what can I really do? And also, why is my milk supply low? Why? What am I not doing rightly? Like, why do people get an increased breast milk supply and mine is just on the low side? Why? That is my question. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 8 reasons why your milk supply is low. If you are experiencing low milk supply or low milk production, I would advise you watch this video because out of these 8, you might be doing 1 or 2 that is causing that reduced breast milk production. So the first one I'm going to be sharing with you is limited breastfeeding sections. So if you are not putting your baby to breast regularly, if you are not giving your baby the opportunity to ask the body to produce, definitely your milk supply is going to be low. Yes. So if you notice that your baby is not latching frequently, definitely that is the reason why you're having low milk production, because an increase in demand increases supply. So if you want to increase your supply, it is advisable for your baby to breastfeed frequently. It's advisable for you to put the baby to breast whenever they are hungry, because the more your baby suckles, the more the breast milk production. The second reason is you've started giving your baby formula. Yes, if you've started giving your baby formula and breastfeeding is not fully established, that is going to affect your milk supply, because your baby is not just taking breast milk, it's also taking formula. So your baby is not demanding enough for the body to produce more. Okay, so if you are giving a formula frequently rather than breastfeeding your baby or putting your baby to the breast frequently, that is going to reduce your supply as a mother. The third one I have to share with you, as a mother, are you smoking or are you taking alcohol? Yes, if you are smoking or taking alcohol, that has a long way of decreasing your milk supply. Yes, the amount of alcohol in your blood is similar to the amount of alcohol in your breast milk. So if you increase your alcohol intake, definitely the amount of alcohol in your breast milk is going to increase, and that is going to affect your baby and also reduce milk supply. It can also change the taste of your milk. So if you are smoking, which has smoking has nicotine, it can also be transferred through the breast to the baby. So smoking and alcohol, they are like brothers and sisters. When we hear about health talk, when we give health talk, when we measure smoking, there's one way or the other we're going to measure alcohol. So they actually go a long way to harm your baby and also reduce your milk supply. The fourth reason why your milk supply could be low is hormonal birth control method. What type of family planning are you using? Is it the hormonal type of family planning method, especially those that contains estrogen? So if your birth control pills or your birth control method or your family planning method contains estrogen, it's likely going to reduce your breast milk production. Yes, it's likely going to reduce your breast milk production, especially if it is taken within few weeks after giving birth. Examples of this hormonal birth control method include your combined oral contraceptive that contains both estrogen and progesterone, vaginal rings, estrogen only contraceptive that can also reduce your milk supply. So if you know you want to exclusively breastfeed, I would advise you to speak with your midwife or your doctor in regards to your birth control method and the type of family planning method you are going to be involved in after birth. That is my honest advice. The fifth reason why your breast supply might be low is breast surgery. Yes, breast surgery such as augmentation, breast lift, breast reduction can potentially reduce your milk supply by affecting the milk duct or the nerves. But I wanted to let you know that some people can do the breast surgery and still breastfeed successfully. It all depends on the particular surgery that is being done, and also who is involved in the surgery, what places are involved in the surgery, what amount of tissues, what amount, how did they go about it, the type of procedure. And the sixth reason why that milk supply is low could be that your baby is not latching properly, your baby is not positioned properly during the course of breastfeeding. In my previous video, I explained signs to know that your baby is latching properly. You can actually watch that video. So if your baby is not latching properly, definitely demand and supply is going to be affected when it comes to breastfeeding. That's for the sixth point. Then the seventh point why your milk supply is low could be as a result of lack of sleep. Yes, when you are not having enough sleep, when you are stressed out, when you are anxious, there can be an increase in a particular hormone known as cortisol. And when there's an increase in that particular hormone, it can also affect breastfeeding. Then the eighth point why your breast milk is low could be as a result of the fact that you are using pacifiers and dummies at the very beginning of breastfeeding. You are using bottles, you are using pacifiers when breastfeeding is not fully established. So before the introduction of pacifiers or bottles, I usually advise mothers to make sure that breastfeeding is fully established, except in cases where bottles is the only option at that particular moment. Then the ninth reason why you are not producing enough milk could be as a result of your baby having a tongue tie. So if your baby is having a tongue tie, that can affect them latching properly. So it's advisable for you to speak with your midwife or the doctor at that particular moment. Then the 10th point I have to share with you is that you are not eating or drinking enough. Though there is no direct research about eating when it comes to breastfeeding, I generally advise please take enough water because the fluid is going out of your body. If you don't, you are going to be dehydrated. So eat properly and also take enough water, because if you don't, that's going to affect your general body, your general well-being, and that is going to affect your baby in the long run. And the last point I have to share with you, which is kind of rare, it's actually a medical conditions. There are some medical conditions that might affect your milk production. So if you know you have any underlying medical or surgical history and you're having low milk supply, it's advisable for you to converse with your doctor, have a good communication with your doctor, and get useful guidance. So this is all I have to share with you in regards to the causes of low milk production or low milk supply, and I hope this video is beneficial. If you have any issues in regards to your breast milk production, you're having difficulty with it, you're having inverted nipple, that can affect your milk supply too. So what I would advise you to do is to speak to your midwife or speak with your doctor as soon as possible for proper guidance and help in regards to that particular situation. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.